First off, my name is Heather Ackerman. I'm going to talk about Chapter 6, which is Teaching Students with Learning Disabilities and Attention Deficit Hyperactive Disorder. First off, let's start with what is a learning disability. A specific learning disability represents a heterogeneous group of students who have cognitive functions and the ability to learn some skills and strategies quickly and easily, but as well have great difficulty in learning other skills and strategies. For example, take a student who may master in reading and writing, but they have a difficulty in understanding mathematics. That would be a perfect example of a specific learning disability. Now, when it comes to the characteristics of students with learning disabilities, it is difficult to list a set of characteristics that are adequately describe all students with learning disabilities. You will notice that all students in your classroom with learning disabilities are more different in relation to how they learn than how different they are from one another. But the certain overriding characteristics that will help identify these students are the unexpected difficulty in one or more academic areas, as well as or the inefficiency information processing or the learning strategies in the areas that are difficult for them. Now, learning disabilities represent a group of disorders that cause students to have learning and academic difficulties. For example, dyslexia or significant reading difficulties are the most frequent academic challenges of students with learning disabilities. When students are learning to read, they have difficulty in phonemic awareness, as well as developing the alphabetic principle and fluency in reading. Students may also have difficulty with reading comprehension as well as decoding the words, which in turn affects their reading comprehension as well. When it comes to the identification and assessment of students with learning disabilities, we look into today. More students are identified as having specific learning disabilities than any other type of disability. During the last 3 decades alone, the number of students identified as having a learning disability has more than doubled, as well as boys are identified 2 to 8 times more often than girls, depending on where they're located in their region. Most students with learning disabilities are identified because of the difficulty with academic achievement. This is where teachers come into play. They are usually the first professionals to notice the students' learning strengths and weaknesses, as well as their academic skills. Now, when it comes to the instructional approach or techniques that are used, there is no instructional approach or technique that is appropriate for all students with learning disabilities because students with learning disabilities are so diverse. In fact, effective classroom teachers report that they must use their best teaching practices to teach students with learning disabilities. One instructional technique is using an advanced organizers. There are 3 factors that seem important to the success of an advanced organizers. First, students with learning disabilities are taught to listen and how to use the organizers. For example, a student might complete a worksheet as they're listening to the teacher introduce each part of the advanced organizer. Second, after using the advanced organizer worksheet, the teacher and student discuss the effectiveness of it and how and when it might be used in various content classes. Third, before an advanced organizer is presented, the teacher cues the student that it is going to be used. These advanced organizers also can assist students as well who are English language learners in orienting them with the big ideals and the key academic vocabulary in learning content. Another technique is using thinking aloud in instructional conversations. One key to succeed for students with learning disability is to make the learning visible. Students should be able to model and discuss using cognitive strategies, which is the thinking strategies. They use these tasks such as finding the main ideal of the story. Teachers and students can also use thinking aloud to comment on or make visible their thoughts and processes as long as they're doing cognitive tasks such as finding the main ideal. Teachers can use discussions to make this visible thinking as well, processes that are needed for understanding. An accommodation that we can use for learning disability students is using learning tools and aids. With new technology, it's increasingly available. Their students are able to use reading, writing, and mathematical disabilities are able to overcome their academic problems through using technology-based learning skills. This is a device or equipment or system of support that helps students compensate for the learning disability. For example, using alternate keyboards, audiobooks, electronic devices, proofreading programs, portable word processors, speech programs like a talking calculator, word prediction programs, all different programs like this. With the use of technology, teachers are better able to organize their classroom and to affiliate effective cooperative learning activities for these students. Another accommodation would be adjusting workload and time. Adjustments of workload and time can be useful in accommodating for students with learning disabilities because workload can seem overwhelming at times, and it just depends on both the amount of the work given and the matter of which it is given. Reducing the amount of work may be a reasonable accommodation when the goal of the assignment or the test is for the student to demonstrate mastery. For example, take a math lesson. Having students work on a problem set of 20 questions, and instead you have a group of your learning disability students where they're going to start off at 5 problems at a time. This actually gives them more manageable time for that student, gives the teacher additional opportunities to provide feedback as well as encouragement at each of the 5 problem sets that are completed. It also breaks it up for the students so that they're not overwhelmed by how much that the 20 problems are versus just 5 at a time. Another accommodation would be presenting the information in multiple ways. Students with learning disabilities may have difficulty processing information when it is presented in only one way. To assist with these students, it is important to present the information in multiple ways. For example, you can do lectures, handouts, you can do hands-on, you can use the technology such as the computers or the smart board, working in groups or working independently. Different ways to bring across the same information in multiple ways will touch multiple students in different ways and able to grasp and understand the knowledge. We are now going to talk about attention deficit hyperactive disorder. The terms attention deficit disorder, or ADD, and attention deficit hyperactive disorder, which is ADHD, have been used to describe students with attention problems. Now, it does break it down into 3 categories, into subdivisions, which is ADHD inactive type, ADHD hyperactive impulsive type, or ADHD combination type. Students who display either or both of these characteristics can be defined as having ADHD. Furthermore, there is evidence to suggest that ADHD often coexists with other conditions such as depression, anxiety, and learning disabilities. Now, ADHD is the intention referring to consistent over 6 months and higher inappropriate levels of at least 6 of the following behaviors: failing to pay close attention to detail and making careless mistakes that are inconsistent with the child's developmental level, failing to sustain attention to tasks or other play activities, failing to listen even when spoken to directly, failing to complete tasks, having difficulty with organization, resisting work on tasks that require sustained attention, losing material and objects, becoming easily distracted, being forgetful. Now, hyperactivity impulsive refers to consistent over 6 months and higher inappropriate levels of at least 6 or more of these behaviors, which is squirming, having a difficult time remaining seated during class, even when other students are able to do so, running or climbing excessively when it is inappropriate, having difficulty playing quietly, acting as if he or she is driven by a motor, and talking too much. Impulsivity is bursting out answers, having difficulty waiting on his or her turn, interrupting others, or butting into activities. These characteristics of intention or hyperactivity impulsive should be presented about the age of before the age of 7, and in 2 or more separate settings, such as at school or home or at a daycare. The characteristics of students with attention deficit hyperactive disorder can include the following: feeling restless, blurting out answers, having poor attention, they're easily distracted, skipping from one incomplete task to another rather than completing a task, being hyperactivity or having difficulty regulating activity, exhibiting demolition rule governing behavior, having increased vulnerability of tasks performed. Identification and assessment of students with attention deficit disorder is unlike learning disability identification. The initial identification of ADHD often involves a medical evaluation from either a pediatrician, a psychologist, outside of the school system. This evaluation should rule out any other reasons for the student's behavior problems and their evaluation to the student's difficulty with attention and behavioral. This is usually accommodated through the use of interviews and a behavioral rating scales by parents, teachers, and when appropriate, even the students. The information that you provide as a teacher can be helpful in determining whether attentional problems are severe enough to be identified as ADHD, and how the attentional and behavioral problems are affecting the students in both the school socially and academically. Numerous rating scales have been developed specifically for the identification of ADHD. A frequent use of the scales is a teacher rating scale, which is where the teachers consider the behavioral of the specific students and then rate their items based on their knowledge of the student's behavior. Now, because of the identification of ADHD is based on a perception of what ratings of the student, it is important to take into considerations of the cultural and ethnical factors that may result in either overdiagnosing or underdiagnosing of the ADHD. Now, when it comes to instructional guidelines and accommodations for students with ADHD, you got to take into the characteristics that help teachers work successfully with students, such as using positive attitudes towards inclusions of students with ADHD, the ability to collaborate as a member of an interdisciplinary team, the knowledge of behavioral management processes, and personal characteristics. Teaching students with ADHD require an understanding, a compassion, patience, concern, respect, and even a sense of humor. Now, educational interventions. Although a teacher often focuses on providing interventions to students with ADHD that reduce inappropriate behaviors, these students benefit the most when behavioral interventions are accommodated by effective instructional design to meet their individual learning needs. Teachers should begin any instructional intervention by planning. And with planning, here are some of the key points that they need to take into consideration. Maintaining a schedule, emphasizing time limits, Prepare students for transitions and provide support in completing the transitions. Using novelty in instruction and directions, such as highlighting important instructions either with colors, colored pens, bright highlighters, felt tip markers, more bold stuff. Providing rewards constantly and often, consistently and often. Being brief and clear. Arranging the environment to facilitate attention. Consider where the students are sitting. It might promote good behavior and organizational skills. It might not. It just depends on where they're located within the classroom. Allow for movement and posture other than just sitting. Get around and dance. Move to a writing center. Move to a reading center. And being able to provide that for the students. Promote active participation through effective questioning techniques. So ask questions that promote students to participate and provide feedback to the student about to the teacher about what the student is learning. Planning lessons for students with ADHD within the content of planning for a classroom as a whole can be a challenge, and is a challenge. The primary focus of planning should be on what accommodations are needed to make the lesson effective for all learners and all students, including all the students with ADHD. Now, since ADHD frequently involves a pediatrician or a psychologist, these professionals actually may recommend that the student be given medication as one aspect of their treatment for the ADHD. About 70 to 80% of children with ADHD respond positively to the stimulating medication, but there are only one aspect of the treatment plan and should be paired with the behavioral and the academic interventions. This is where a teacher comes into play. As a teacher, you want to monitor the positive and negative effects of the medication and work with the parents so that the physician can be informed with what the student is going on. As a classroom teacher, with the monitoring, it is important for you to notice if there's any changes, as well as their intention, in their activity level, in their frustration level, in their instructional skills, in their behavior, in their interest in schoolwork. What about changes in their academic performance? You need to notice if there's changes related to changes in the dose of the medication, or even side effects. If you've noticed a loss of appetite, you've noticed more sleepiness, more headaches, stomach aches, mood changes, they're irritable, you need to let the parents know so that they'll be able to communicate that with all the professionals involved in the student's treatment of their ADHD, including with the education as well as the medication.